We are reporting today 4 additional cases of COVID-19, all related to the known outbreak at the Wacol Correctional Training Academy. Some of these cases have been reported in the media during the previous 24 hours, and so I'll go through them in a moment. As I say, some have been publicly reported but not publicly notified by us or Queensland Health at this stage. So those 4 additional cases mean we now have 24 that are active, most in the southeast, the largest number in Metro South and West Moreton. We have now had a total of 1,117 cases. 18 of those remain in our hospitals, and as I say, mostly in the southeast. We had another fantastic testing period, and I really want to thank Queenslanders and our scientific and laboratory staff. They processed 18,763 samples to find those 4 positive tests, which is a really promising result. So the 4 new cases, a case of a man from Greenbank who was another trainee at the Correctional Training Academy, a 30 to 39-year-old female from Forest Lake who is the wife of another of those trainees who was previously reported, a 30 to 39-year-old woman who is the wife of one of the Pimpamar cases, also previously reported, and a 60 to 69-year-old female, again the wife of a case previously reported. She lives in Forest Lake. As you can see, 3 of these 4 cases relate to household transmission, and we've always said all along that households are one of the highest risk of transmission locations. Very hard to quarantine in a household. It underlines how important it is that we have restricted the number of people in households. That will greatly minimise the risk of widespread transmission in the community in households. It also underlines why it was so important that we brought in hotel quarantine. We brought in hotel quarantine when we were seeing people returning to the state and then giving the virus to other people in their household, their wife, their husband, their children, other family members. And so it is hotel quarantine that has helped us limit that household spread. It's also household spread is also what we know was a key driver of the early cases in that second wave in Victoria. On that note, let me say how fantastic it is to see Victoria's case numbers decreasing. For the first time, they're reporting less than 100 cases in a day, the first time for a significant period of time, and that represents that they are having gradual success at getting on top of that second wave. I congratulate them and continue to offer whatever support we can provide. You will have seen in the public health alerts that were provided yesterday that there were 2 locations where people known to have been infectious visited in the Toowoomba region. And so for that reason, we are today advising people who live in the Darling Downs Hospital and Health Service districts that we will be expanding the restrictions currently in place in Metro North, Metro South, West Moreton and the Gold Coast to the Darling Downs HHS region. That will be effective from 8 a.m. Monday, and all of the same restrictions will apply. So from 8 a.m. Monday, people in those local government areas will be limited to 10 people at gatherings in non-COVID safe venues. COVID safe venues, businesses, cafes, restaurants, pubs, they can continue to operate as normal, but we are limiting the number of people who can be at a non-COVID safe event to 10. We will also be applying the restrictions in aged care, in disability accommodation and in hospitals from 8 a.m. on Monday. That means people can go about their visits to loved ones in aged care facilities in the Darling Downs region tomorrow, but they will be restricted from Monday onwards. We are dispatching additional protective equipment to our hospitals in the Darling Downs region today to ensure that they have those masks and gloves, everything that they need to keep themselves safe. You'll also have seen in those public health alerts that there is an important alert related to the Graceville Netball Centre. We know that last weekend there were people there who may have been infectious, and that a lot of people go there. I understand they have 20 or more matches a day, that it is a busy netball centre, that people congregate around the canteen. It is closed today. The matches that were due to be there today have been suspended to keep people safe. But I want to use it as an opportunity to remind everybody who is at community sport this weekend that it's incredibly important that you comply with the COVID safe plan for your sport. Check in with those QR codes. Keep your distance between household groupings. That's incredibly important, and it's important not just while spectating, but also while congregating around canteens and toilets, entry and exit points, that kind of thing. That's the extent of the update from me. I'm happy to take questions.
Is it possible restrictions will change around community sport, or it's too early to say?
It's too early at this stage, and I'd emphasise that we are not reporting infections from the netball centre. We are, though, reporting that people believed to be infectious were there in a location where many hundreds of people gather, and so it's a cause for concern, of course. That's why we've issued that notice. That's why we have notified teams and coaches, players, families. But it's a chance to underline just how important it is that those COVID safe plans are complied with, no matter where you are. And community sport is somewhere a lot of people will be over this weekend, not at the Graceville Netball Centre, but at other locations, as you will have seen as you arrived here today.
Deputy Premier, what about staffing in prisons? Obviously more cases from the Wacol training area. We've seen those cases in the youth detention centre as well. What's happening with staffing? We've obviously have staff going into isolation, I imagine. So how are you managing those numbers? Yeah,
there will be a lot of staff going into quarantine. Commissioner Martin is here and is able to speak to the operational matters. Did you want me to get him now, or do you want me to finish taking questions and then go back to it? Yeah, okay.
Beautiful weather this weekend. There's heaps of people out on the roads, out and about. Are you worried that people will be complacent and those gatherings in those restricted areas will be more than 10?
Yeah, we are worried about that. It's relatively recent that we introduced these new restrictions. They only came into effect today on the Gold Coast, and so we're really trying to get the message out there, and thank you very much to the media for assisting us to get the message out there that this weekend there is COVID in our community. We know there is. There are confirmed cases. There are many days over the previous fortnight where we know people have been in the community while infectious. That makes this an incredibly dangerous time. This weekend, an incredibly dangerous time. And so we would urge everyone to do what we've been doing. We've been doing this all year now. I think people know what the restrictions are. They know how to keep themselves safe. And we just underline that while there was a period of time there, a long period of time, where perhaps we could let our guard down because there wasn't virus in the community, we know that now there has been virus in the community, and that should change things.
Just on that tragic case of that baby, there's been a lot of reporting around that. Can you confirm, did the New South Wales Hospital, Lismore Hospital, make any contact with Queensland authorities to check if that family could come to Queensland?
Look, I want to say a few things about this case because a lot has been said about it. First of all, can I say that these last 24 hours, watching politicians use this tragic event to further their political arguments, it's left me feeling sick. What Deb Frecklington said yesterday was disgusting. It's unbecoming even of her. Our emergency services do their very, very best every day to save lives. The border direction is very clear. It does not apply to people seeking emergency health care or those accompanying people needing emergency health care. Now, I will write today to the New South Wales Health Minister and I will ask him to notify all of the hospitals in New South Wales to ensure that they are aware of these arrangements. I have spoken to the Chief Executive of the Mater Hospital, where it is claimed that this occurred, and he has assured me that they have no records of the kinds of claims that have been made, and he has assured me that he will ensure that everyone within his health service is aware, but I want to emphasise that our hospitals and our aeromedical evacuation services save lives every single day, and there are no borders that restrict them saving those lives, and they will continue to do so. Of course, this is a very tragic but also a private matter that there are limits to which I can disclose information about, and I respect those things. You all know that I never have and never will disclose private patient information, but I can assure you that we are doing everything that we can to ensure that everyone is aware these border restrictions do not limit the movement of patients requiring urgent or essential care.
Why are you only writing?
There though, because if you have to write to the New South Wales Health about that, and obviously the Lismore Hospital didn't know whether they could send someone across the border, so you can see there is confusion there to an extent.
Oh, look, I can't speak for hospitals in New South Wales. All I can do is tell you that our hospitals, our clinicians, our evacuation services know that the border restrictions do not apply. And so if there is a communication problem south of the border, I want to fix it. And I will do that by writing to the New South Wales Minister and asking him to convey that to those hospitals.
Do you think there's a few comments about Queensland hospitals that Queenslanders have confused people in recent months?
Look, I think that it's unfortunate that these kind of tragic events are being used by some to further their political arguments. Nobody can show me any evidence whatsoever that a different outcome here in terms of the location of transfer would have changed in any material way the very, very tragic outcome. We have fantastic hospitals here in Queensland, and I think the Premier was trying to emphasise that, but they're very, very good hospitals in New South Wales too. The RPA is a fantastic hospital, and if a life can be saved anywhere, it can be saved at the RPA just as well as it would have been at the Mater, also a fantastic hospital.
Why wasn't this foreseen? Why didn't Queensland Health proactively speak to the hospitals in New South Wales and the health service there? Because it's obvious that something like this could have happened.
Well, I think we've been very clear from the beginning. Look, I can read to you the direction. The direction says it does not apply if the person is entering Queensland to obtain essential health care or as a support person of a person obtaining essential health care. Now, I don't think you can be clearer than that. If some people in hospitals in other states have misinterpreted it, well, that's a shame, and we will do our best to correct that. But at no time have we not have we attempted to apply the border restrictions on people requiring emergency care, and we never will.
Does there need to be a national definition of hotspots, which the Prime Minister wants?
Look, I've seen those comments from the Prime Minister. I don't think they'd be particularly useful. I think states are managing the health response here, and states need to continue to be able to manage the health response based on what's going on in their particular states. Frankly, Scott Morrison should spend a bit more time on the things he's responsible for, like international borders, like aged care, like supporting the Victorian government in their response, and a bit less time lecturing those states that so far have done a very good job of keeping on top of COVID and are doing their very, very best to keep their communities safe in an ongoing way.
How many cases are now connected to this training centre?
So across the Youth Detention Centre and the Training Centre, we're reporting 19 cases. Commissioner Martin will be able to tell you how many of those relate to the Training Centre.
Further be done in terms of regional testing or getting to the bottom of
No, unfortunately, that's the extent of the usefulness of that genomic testing. It identified a very common strain of COVID-19, meaning it doesn't answer the questions we'd hoped it would. That remains a mystery whether there was a link between the Melbourne Logan cluster, the Brisbane Youth Detention Centre cluster, and now the Corrections Training Academy cluster. We would very much like to link those three together. If we do, it will be by identifying cases in between or through our contact tracing, our interviews with those individuals.
Deputy, can we just briefly on something else? With Schoolies Week activities cancelled, do you think school leaders will comply with restrictions, and what kind of expectations do you have for the class of 2020?
Look, I really think they will. This is a real shame for the class of 2020. Their Year 12 has been greatly affected by COVID, but I think it means they're also more aware than probably anyone about what the restrictions are and how it applies to them. I hope that they do find ways to celebrate what's an incredibly important milestone. Finishing Year 12 is an incredibly important milestone, and I hope they find ways to do that with their closest group of friends, so that they can do it in a safe way and in compliance with the restrictions. Of course, police will be enforcing those restrictions, not just on the Gold Coast but throughout the state, and so that threat remains, that it may be enforced, but I would expect, just as we have seen throughout this entire thing, that Queenslanders, no matter what their age, they do the right thing.
As rules change, people with exemptions for compassionate grounds are still being turned around at the border. Will today's announcement make things easier for people from New South Wales trying to say goodbye to terminally ill loved ones in Queensland?
I'm not. What are you referring to?
As rules are, I guess, changing,
Yes.
people with compassionate grounds are still being turned around at the border. So, like this, I guess, what's come to light in the last few days, will this make things easier for people, from New South Wales to say goodbye to terminally ill patients in Queensland?
No, they'll still require exemptions to do that, and each of those is considered on their merits personally by Dr. Jeanette Young, the Chief Health Officer. Where it can be safely facilitated, it will be, and our hospitals have protocols in place to allow that, infection control spaces, protective equipment, that kind of thing. But it's important to remember that these initiatives are all put in place to keep our community safe. Yeah, sure.
Are you able to confirm the number of cases now connected to the training facility?
Sure,
Yeah.
sure. Happy to do that. So Peter Martin is my name. I'm the Commissioner of Queensland Corrective Services. So at the moment I can confirm that we have 5 positive cases linked to the QCS Academy. And there is a direct link to the Brisbane Youth Detention Centre, having regard for the proximity of the area, the Youth Detention Centre, to the Wacol site. Of those 5 staff, we have a trainer that initially tested positive, and we have 2 recruits. There is also 2 additional staff that come from the Arthur Gorrie Correctional Centre that happen to be part of a team of 14 officers that undertook training at the academy. So 2 out of the 14 have tested positive. That has now led us to launch inquiries in consort with Queensland Health at Arthur Gorrie Correctional Centre. Now, Arthur Gorrie Correctional Centre is a very large and complex correctional centre. Its business is primarily remand-related prison work. There are 1,060 prisoners on that site, and there are 530 employees. Today and tomorrow is a concerted effort in consort with our colleagues at Queensland Health to test those officers on site. And of the prison population, we've identified a group that is more at risk than others, 170 or so prisoners, and that's our early work to test those prisoners. All of that work, we're hopeful, will be resolved by end of this weekend. And in the first hour of opening the testing clinic this morning at 10 a.m, we tested some 45 or so officers. So work is progressing really fervently in that direction, and our hope is to have all of that work done by the end of this weekend.
How long will those lockdowns last?
So the prisons are currently at stage 4 from Rockhampton, including Rockhampton South. That encompasses 14 prisons. The prisons that aren't in scope at the present time are Townsville Correctional Centre and also Lotus Glen Correctional Centre. So of the 14 prisons, including those at the Wacol site, since early last week, they have been at stage 4 lockdown, which is fairly significantly onerous in terms of the staff and also the prisoners, particularly in terms of movement. So the prisoners have been locked in their cell, and regrettably that is a terrible situation. It is certainly not what I would want to do, but under the current advice from Queensland Health, that is the only option that we have to keep the prison population and the staff safe at those locations. And stage 4 restrictions will be in place until the Chief Health Officer advises me that it's safe to alleviate that stage 4 restriction.
So how long have prisoners been locked in themselves? Have they been out at all?
The prisoners will be locked in their cell. They will have medications in their cell as needed. They will have food in their cell, but they will not be able to leave their cells over this particular period, because you just can't, in the built environment the way that it is, move prisoners out of those cells for any length of time without the risk of cross-contamination. It's just not possible. There are currently 9,000 prisoners in Queensland. Of the 14 prisons that are currently impacted by stage 4 restrictions, bearing in mind that Townsville and Lotus Glen aren't, there are 7,000 prisoners impacted out of a population of 9,000.
Are you expecting an increase in incidents if they're locked in their cells and not able to get out?
Look, it's a very real issue, and certainly the level of aggression, the temperature, the prisoner population so far has been really compliant. We're working really hard in terms of our messaging. Our staff have done a great job to get the messages out to the prisoners and the prisoners' family. This is the last thing that we would want to do, but they've been quite tolerant because they know we're doing this to ultimately keep them safe.
So how do you sort of staff?
I'm sorry, watch house operations are not the business of Queensland Corrective Services. That's a matter for the QPS Commissioner. But there would be prisoners that would be kept in the watch house who would not be released to come into a corrective services facility because of the risk of our prisoner population and the risk of the staffing group. And also, it's really important to recognise that any people that leave a correctional centre under stage 4 and when they return to the prison also are subject to those further isolation provisions as part of the current arrangements. My great hope is that this is short-lived, that we can reverse this current situation. It's certainly not what I would want to do, but at the moment I have a lack of other options.
So how many days of staffing in terms of moving staff around? You've obviously got a number of staff in isolation, the possibility that more will have to go into isolation, possibly more will get sick. How are you, I guess, dividing the staff members up? Do you have to bring staff from other prisons to Wacol?
That's a really good point, and the reality is that this is a very, very difficult and challenging environment to manage those 9,000 prisoners, and also we've got 20,000 offenders that we manage in the broader community. So managing the workforce, bearing in mind that we also need to make sure, to the degree that is possible, we don't facilitate cross-contamination from one centre to another centre, but managing the workforce, a workforce of 6,500, and a sizable amount of that workforce are devoted to the work of the prison operations, and it's a very significant challenge. But we've always got Plan B and Plan C within the context that if we have to isolate a sizable proportion of our workforce, that we have a range of contingencies in place.
What are those contingencies? Are you bringing staff, say, on a more permanent basis from, say, prisons in Townsville down to Brisbane or vice versa?
Yeah, we have to be very careful of moving our officers around from prison to prison, having regard for the issue of cross-contamination, and everything that we do operationally is guided by the best advice of the Chief Health Officer in Queensland Health. But we have a range of options, and we can use staff that are non-custodially trained, we can use staff from other centres, and if worse comes to worse, we have the full resources of the Queensland Government to bring to bear, including arrangements under the disaster management arrangements. Some of that might be other Queensland Government employees, it might be Queensland Police, or alternatively it might be the ADF, but I can't conceive currently of a situation where those contingencies would be required. I'm confident at the moment, guided by the best advice from Queensland Health, that we will be able to use the resources. This is unprecedented, unparalleled. To respond to a very difficult domain in a 1 in 100 year pandemic is very, very challenging. We've got very good plans. Our plans are mature. We've got very, very good support by Queensland Health. And our planning processes are working really effectively, and we demonstrated that last week when we were able to, in a really fast and agile way, move to stage 4 restrictions. So multiple times a day we're sense checking what we're doing with the Chief Health Officer and guided by the work of Queensland Health, and I'm really confident that we'll get through this the same way that the rest of Queensland is getting through a very difficult and challenging time.
Just to check, are the youth detention centre in that same lockdown? I think you're locked in.
I'm sorry, I can't speak about the Youth Detention Centre. That's not part of my responsibilities. So I can only talk about the adult prison population. The 9,000 prisoners currently in Queensland are my responsibility.
One more from them.
That's okay.
There's one more on Schoolies. Official booking site, Schoolies.com, is still taking reservations for Schoolies 2020. Won't be funding deposits to pay. Should they be more accountable? Is the government looking at giving the announcement?
So I only heard this morning that private company continues to take bookings and deposits. They should stop. Certainly the message to young people should be don't go ahead with bookings now, and I would urge them and all tourism providers to be very flexible in allowing young people to change their bookings in order to be able to comply with this decision. I really don't want to see any young person who will have saved hard in part-time jobs to put towards their schoolies. I don't want to see them out of pocket, and I think if organisations like this want to work with us into the future, I'd urge them to look to the future, to be responsible and to take care of their customers.